Bismillah ar-Rahman ar-Rahim. Honorable Major General Amir Ikram, Executive Director, National Institute of Health, Chairman, Board of Governors, Ambassador Khalid Mahmood, Director General, Institute of Strategic Studies, Ambassador Azaz Ahmed Chaudhry, distinguished guests, ladies and gentlemen, Assalamu alaikum and good afternoon. It's my great pleasure to welcome you all at today's public talk organized by China-Pakistan Study Center at Institute of Strategic Studies, which will be dwell on China-Pakistan covert cooperation. In evolving geopolitical situation, Pakistan-China relations have come forth as a shining example of unity and strong diplomatic ties. As the coronavirus pandemic spread, countries realized that it is extremely serious and a comprehensive cooperation was required to contain the deadly virus. Soon after the outbreak of coronavirus, China took prompt measures and decisive actions to stop the spread of coronavirus. China helped the world to deal with the pandemic, and world at large benefited from Chinese experience. In the wake of pandemic, China's support to Pakistan in the fight against coronavirus was remarkable and strengthened the bond between the two countries. China has been consistently helping Pakistan with COVID-related equipment, medicines, and now vaccine. In the challenging times with shadows of COVID surge, both the countries will have to continue their joint efforts to fight the menace of coronavirus. More on this from our distinguished speaker today. And before I invite General here, I would like to briefly introduce him to you. Major General Amir Ikram has served in the Army Medical Corps for over 3 decades. He holds multiple academic distinctions and honors from some of the world's leading medical institutes. He has represented Pakistan at various international forums, including United Nations Biological Weapon Convention. He has more than 300 publications to his name and has served as Chief Editor of Infectious Disease Journal of Pakistan. General Amir is actively engaged in designing policy guidelines related to health and safety and has been council member of International Society of Infectious Disease and member of task force assigned to implement World Health Organization's international health regulation in Pakistan. He is recipient of Biosafety Heroes Award by International Federation of Biosafety Association and received Sara Imtiaz Military from Pakistan Army. He was appointed Executive Director of National Institute of Health in August 2017, where he has been applying his expertise to tackle various health issues in the country, including the coronavirus pandemic. Sir, you have the floor, please.
Bismillah ar-Rahman ar-Rahim. Excellencies, colleagues, and participants, I indeed feel very honored for this privilege of being here today. Grateful to you, sir, and to all the dear colleagues. Times definitely are very challenging, and I think for years and years we have been talking of eventuality, and unfortunately we are into one. There's been a lot of learning, but I think the best point is picking up those challenges, finding those gaps, and leading accordingly. And I think one such example that we fought the first wave and second wave of corona in a very formidable manner, and we are still quite hopeful as we move on. Definitely we will fight this third wave as well. Now, in particular, talking of China, I think yesterday there was a planning commission meeting, and I had to tell one of the seniors for certain points about China. I said, I mean, they've been increasingly helping us in all the fields. We started off from a very small scale interaction, but today maybe I'll showing you a little bit of glimpses of what we have done together. But it's been an amazing support, and I think जो हम कहते हैं हिमालय से ऊंचा और समंदरों से गहरा. We have no doubt about that. And this is just one example of the medical collaboration that we conducted during this crisis period. Just to take you a little bit of background, in almost every century there has been a pandemic. And even in the modern day science, when we could never expect with the high-tech things available all across, we are into one, as I said. So for years, we talked of eventuality. Today, we are into corona. Unfortunately, tomorrow, we may land up in another one. And as you just heard about the International Health Regulation, which is a very composite program under WHO umbrella, and then bringing it another touch with Global Health Security Agenda. And Pakistan was fortunate enough that Pakistan underwent a joint external evaluation in 2016, and we could come up with the gaps existing in the different health system, more so related to the infectious diseases. If you see this slide, you can make it out that we all understand the time it started spreading. Then in China, the whole genome sequencing was done. And unfortunately, the first death was reported last year on January 11. And then, unfortunately, no time turning around in March, we had more than 1 million cases, and then moving on to the next stages when it was announced as a global pandemic. There's some very myths and so many theories about the spread of this virus, and I mean, it needs again hours and hours. We can talk about that sometime later on. And as we see, it's an ever-increasing pattern. I mean, the whole world went through the first and the second waves, and most of the countries, unfortunately, are. The problem with the third wave, I would just like to highlight, is the variants. It's basically, in our term, we call it as an RNA virus, which are quite notorious for their mutations. And this third wave in Pakistan, unfortunately, is mostly through the UK virus. वो जो छुट्टियां गुजारने सारे इधर आ गए पता चला कि उधर तो सब बंद है. They just rushed to Pakistan to enjoy this time in Pakistan, but unfortunately they brought this virus to Pakistan and started from certain areas. And alhamdulillah, this is the first time that we have evolved capability at NIH to pick up these things, which is with a very tedious high-tech job as far as the whole genome sequencing is concerned. But coming up to the national and international expectation, we started off this thing, and we're closely monitoring whether it's the UK strain. Till today at NIH, we have not detected the Brazilian and South African. But as we move on, there'll be so many. There is another double variant in the neighboring country. Let's hope it doesn't come to Pakistan. Yet another variant coming in California. So we have to follow up at the international level and how we move on. So what we need, I mean, is basically the collaboration. Collaboration not only within the country, but extending much beyond the borders. And that is one example between Pakistan and China, where we stood together, and we are still standing together. I'll briefly give you an overview of what NIH has been. I've been there for last 3 years, and fortunately we started preparing otherwise under the garb of GHSA and IHR to look into the modalities where we could fight such things in future, but landed up in COVID crisis in 19 and now 20, and then late 19 in China, but it came down to Pakistan in March last year, and unfortunately still very much there. And you may ask a question later on, kab tak chalega? Well, it's a big question. We can talk about that again at length. We have different divisions, but just to show you 5 main divisions, we are responsible for the public health labs. And for the first time, alhamdulillah, we established provincial labs all across the country as well, which have performed immaculately during this corona crisis, picking up the brunt of testing at the center. Then we have a field epidemiology division. We look after the surveillance, and that is the one, maybe people coming to you for contact tracing, taking your sample, your relative sample from home. And my hats off to all those teams. I always say I'm a soldier. I've served in all parts of the country. If army orders me, I have to move. But I am extremely pleased with the NIH teams and other collaborators with us who have been working 24/7 for more than a year now. And that's the strength of any country, I must say that. And all praises to all those who have been working and all those who have been following us as well. So we have a nutrition division, then a drug division, which is the sole appellate court for the country, and the last one is the most important, is the biological production division. We are trying to uplift and develop the capacities to start full vaccination production within the country, and inshallah shortly you will hear we are working on one of the corona vaccine. We, as I already said, we are working on IHR, GHSA, and the next concept is the One Health, ki health sanji hai. It's not only the human, but the animal, plant side, and all side. All the living things have to go hands in hand. And why it's so? Because animals, they are very, very important, because 70% of the infectious diseases, they are transmitted from the animals to the human, which are known as zoonosis. So we have to be very careful, and corona is just yet another example. Then once it started, I mean, we started working in the early days. We got in touch with the Chinese government. We established an emergency operation center with the emergency telephone number for contact, for providing not only solution to their answers, but actually for contact tracing, screening, and all those modalities. And it is still going on at National Institute of Health. We'll be having a much bigger mandate, because we have a new legislation in the form of ordinance, whereby it is becoming the National Institutes of Health and the Research Council, and so many other redundant institutes which are lying and contributing nothing would be coming down under NIH, inshallah, shortly. So we started working. For the first time, we prepared a national action plan totally dedicated to the COVID, and we did definitely get a lot of help from the Chinese experience. And based upon that, this national model was prepared. But side by side, we started actual drills, hands-on exercises, triage, and all the site. And this is for the first time, alhamdulillah, that our teams went to across all the point of entries, including Taftan, Gwadar, whether it was a sea entry or whether a land route. So everywhere NIH teams have been going there and dedicatedly imparting training. As you can see, what we established at the Islamabad airport, this was the prototype, and then it was replicated at all other airports. And I think we were quite much more structured in the initial days, and moving on with learning with the experience and then implementing. So many activities for preparedness and management. It is always said about any biological eventuality that you cannot prepare during an eventuality, you have to be ready for it. But alhamdulillah, we take this pride as a country, as a nation, which has been acknowledged by WHO, by Gates Foundation, the way Pakistani nation responded. And let's hope we still continue that and give a formidable fight against this virus. This was for the first time that we established the mobile lab, and this lab, alhamdulillah, was transported to, which is a biosafety level 3 lab, the only one available in the country at Taftan border. For almost a year it has been there, and now we have shifted it to Gwadar. And again, this was being maintained by NIH, and it performed all sorts of testing at the border areas. Then we started off for all the screening and testing, different center. Let me share that we just started off with 300 tests per day at NIH, and we give small little quantities to two of the private hospitals as well. And here I would definitely again commend, because we were the first country in the region which were provided the testing kits, which is a very, again, in simple word, it's known as a PCR test by China, and special plane was flown through courtesy of Government of Pakistan, involving our ministry and then the Ministry of Foreign Affairs. I think the Ministry of Foreign Affairs again played a very, very lovely role during this crisis period with strengthening the system. So we started off we started those guidelines, and today, alhamdulillah, as of today, we have 189 labs performing PCR all across the country, whether it is the public sector or private sector. And then when doing test is one component, the other one is providing the quality assured test. That अगर मैं आपको टेस्ट दे रहा हूँ तो आपको assurance है कि जी ये positive है तो वाकई positive है, negative है तो वाकई negative है. Now this is the picture. One of my own PhD students, he went in C-130, an amazing experience for youngsters, lifetime experience, I must say, for a civilian traveling in an Air Force aircraft and getting these done. Out of our own courtesy, what we could do for them, we transported a little bit of personal protective equipment because there was a shortage in China at that time, and this sprint brought along the testing kits with it. I'll just keep you, would not like to bother with much of the technicalities on our side, just glimpses of what has been going on during this period. Now, what comes next is different delegations coming to Pakistan, and actually going to all the sites. I'll give you a pictorial view about that as well. But I think during the crisis, they never forgot Pakistan. There was a military delegation, there was two civil delegations, and NIH again got the privilege of hosting them at NIH, and it was an amazing share of experience. Whatever we could extract, and they were so open in this regard. Not only that, they did bring in some of their latest modalities that they were trying in China, going beyond the this medical side to traditional and herbal medicines. That is an amazing experience. And just before the COVID, we signed another traditional and herbal medicine program with the Chinese universities, and hopefully, inshallah, as the intensity of infection lowers, we'll again start working. क्योंकि हमारे यहाँ बड़ा concept है जी देसी दवाइयों का, तो वो पता नहीं मुझे, मैं डॉक्टर एज वेल, सो वंस द पीपल से जी ये खाते हैं तो दवाई से गर्मी हो जाती है, तो हम समझाने में नाकाम रहते हैं कि गर्मी कैसे कभी नहीं होती है. It's never like that. But this is a usual concept because the thing is they do have a faith in this herbal medicine so much that they would not even be keen to take a Ponston. So there are so many categories like that. And China has gone very advanced as far as herbal medicine is concerned. There have been so many things coming up in Pakistan as well regarding different jadi booty hai, but the thing is, you see, you cannot try such things without ethical approval. There is a international and national protocol for that, and only you bring in at the end of the day authentic चीज़ों. इसकी मिसाल मैं आपको वैक्सीन की दूंगा कि you must have seen so many trials going side by side all across the world. So many vaccine, more than 200 molecules coming to the international arena. And right now, so many still going different phases of trial. There are different stages. First is the animal trial stage, then is the phase 1, phase 2, and phase 3. And then moving on to the actual approvals through all the authorities, and then launching it formally. And even then it doesn't stop. There is a phase 4 as well. Jab vaccine launch hogi, we have to monitor the side effects and efficacy. And that is done in phase 4 trials. Just glimpses, as you can see, even crisis, they never really even bothered. I mean, we took them to the hospital where actually we were keeping the corona patients, and one of the experts who had actually been dealing, the medical specialist, with all the corona patients in Wuhan. So that was an amazing experience that we could get in the initial days. So many discussions with them openly, as you can see. Then we took them to Punjab. Again, it was tedious because at that time we were entering into our crucial first wave, and the virus was rampantly spreading all across. But again, the government of Punjab, they were also very excited to have them. And this is not one delegation, one after the other. As I said, in tandem, 3 different delegations coming at different times. Then with 6th of April, they were taken to Sindh in a special Air Force plane again. And that's something also very, very important, bringing all the stakeholders together under one umbrella. And by that time, we had the National Command and Operations Center also established. And I must appreciate the efforts undergone at that level for uniting all the stakeholders in order to have a very structured and methodical approach in delivering to the country. I have been, for the initial 3 months, because the way we were working, we definitely were faced with many challenges. And I think thinking and strategizing is just one aspect, is the actual implementation. And that's the area, unfortunately, where we were lacking, and that was provided by NCOC. Until today, alhamdulillah, we are functional. And the passion that they show for Pakistan is also to be seen wherever they have gone. Now, side by side, there was a pure military delegation which was brought to the military side as well, but they also visited NIH, and we had some very good reaction. The Present Surgeon General, she was a Major General at that time, receiving the delegation, and then having interaction with all the senior hierarchy on the Army Medical Corps side. Now, one thing is very important that we learned, the Chinese, they built within a month and 2 months, 16,000 bed. That is the, I think, true hallmark of Chinese capabilities, what they can do. They can really do wonders. And I think learning out of that, they did provide us a grant as well, whereby we could lay down such a hospital. It is within the vicinity of National Institute of Health, and shortly it would be handed over to us. And we have already in the process of converting into a clinical trial center. I would just like to lay a few words about clinical trials. It's $1 billion industry all over the world. And unfortunately, we have never cashed that. So now we are working very hard to bring in much more trials. And the first, I'll just share briefly, we conducted, there's a huge line, whether it's Australia, UK, other countries approaching us for clinical trials in Pakistan. Now, this is the hospital which was established just within 40 days through the Chinese grant, and established on a similar pattern as they have been established in China. And 40 days is too small a period. It's a 250-bedded hospital with all the international requisites, and it's fully functional now. Up till now, 70 beds have been made functional, but inshallah, shortly it will be fully functional with the total capacity of 250 patients. And you can see the quality with all allied facilities. You can see these oxygen and other things that are required by the bedside. See the finishing. And this is the overall structure of this hospital with wards. And this is the first ever modular type of hospital. The one COVID is over, right now it is totally dedicated to COVID. Once it is over, we can have one ward for TB, another one for dengue. वो जब हम कहते हैं कि जो मरीजों का रखा जाता है वो दूसरों. So this hospital is basically having state-of-the-art HVAC system, the number of changes of air with negative pressures inside. So this infection बाहर नहीं निकल सकती. Now that is a very, very important component. And 40 days is too small of a country like us to make such a big venture. But alhamdulillah, we came up to the expectation of the country. Now this was in any case done by the Frontier Works organization of Pakistan Army, and the way they work day and night, maybe sometime later, but its video is available online. It's 40 days how they did that. Then another team coming down and starting trainings at different peripheral hospital. Mayo, as you understand, one of the big hospital and contributing a lot. And as you can see, so many senior persons sitting over here, the Vice Chancellor of University of Health Sciences, and then the College of Physician and Surgeon, Professor Gondal, and all other allied facilities. And not only that, as definitely CPAC is your area of interest, they were also taken to this site as well. And that was a very big excitement for them. As we go to China and we are more keen to see the Great Wall of China, probably this is a small wall for them, but they really got excited seeing all that. Then we had plenty of visits with different, and till today we have developed a channel whereby we have regular meetings with the Chinese CDC. CDC stands for the Center for Disease Control. Unfortunately, Pakistan never had any, but with the new legislation, alhamdulillah, CDC Pakistan has been launched, and shortly, hopefully, we'll be having an inaugural ceremony for that. We have done all the spade work, and this CDC would be coming down as one of the institutes under National Institute of Health. So whatever we have learned will go in a very formidable manner for future eventualities. We are trying to make the things much more robust and composite. Once NCOC finishes, inshallah, jab ye khatam hoti hai crisis, all the things that NCOC is doing would be handed over to CDC Pakistan. And as mutually, recently we signed yet another MOU for enhancing the collaborative research. And till today, even this crisis, we have been exchanging different research projects. And one of the main was the genomic surveillance in Pakistan and China, and some amazing results coming out of कि ये वायरस क्या था, कहाँ है और कैसा है. It's a very fascinating in a technical words. Just briefly, I told you about the biological production division. We do manufacture certain vaccine, and unfortunately, Pakistan till today just produces 7% of the requirement, and 30%, 93%, we do spend a lot many government exchequer in the form of dollars in procuring those vaccines. So this is one of the projects, alhamdulillah, that we took the initiative at NIH. The project was started in 2004, and once I landed up, what I could get was just 6 pillars in one of the corners of NIH, and to my fascination, as I was told such a दर्दनाक story, उनका मकसद ये था कि ब्रिगेडियर, I was brigadier at that time, कि ये इसको ना छेड़ें कहीं, वो मतलब because funds हम सारे labs कर गए थे in 16 years. But I fought the case with Planning Commission. We got the grant, and this, alhamdulillah, is the first ever GMP, which is the Good Manufacturing Practices, ISO certified, Good Lab Practices certified Sera production factory for the country. It can produce whatever is required as far as anti-snake venom, anti-diphtheria, anti-tetanus, and anti-rabies is concerned. And we can go much beyond. And this, inshallah, will soon be utilized. This one will soon be utilized for CanSino vaccine, as I'll just narrate briefly. So we have different projects, as I said. We have different filling now coming up. And one pride that NIH takes now is bringing in the first ever phase 3 clinical trial. As I said, it's $1 billion industry, and our neighboring country is picking up from all over the world, and that's why they have become pharma tycoons as well. 10 of the richest pharma tycoon out of 7 belong to the neighboring country. So this, क्या कहते हैं, लम्हा फिक्रिया होना चाहिए. So seeing all those, we did the first ever phase 3 trial for CanSino. It was a very tedious job under such turmoil condition, and they increased the target from 8,000 to 18,000. Based upon our performance, we gathered 18,000 candidates, and we did this. Alhamdulillah, it was a very, very successful trial. I had the honor of being the principal investigator. So we kept moving. We started this, and many meetings with the Chinese counterparts. And then starting at 5 different centers, including Shafa at Islamabad, Shaukat Khanam, Aga Khan, University of Health Sciences, and Indus Hospital. And just to say briefly a few words about this thing, can This is just one example, this trial, as I mentioned. And what is the outcome of this trial, Alhamdulillah, as we had 75% efficacy of this vaccine in Pakistani population. The benefit and as in form of availability, because they did reserve 20 million doses straight away for Pakistan. It's a single dose vaccine. Yes, yet another big thing for a country like Pakistan, where we talk of elderly and what we have seen during this crisis period. It becomes difficult to bring out people beyond 80 to actually sites for vaccination, and more difficult bringing them for 2 times. So with all that in mind, one is the availability, affordability is yet another aspect whereby we got a much reduced price for this vaccine as compared to all other vaccine available in the market. And third was that they guaranteed that availability till Pakistani airports, which no other vaccine company would pick up. So this is the benefit of trial that we can do. And then this is the same vaccine that we are procuring the stage 2 technology transfer from China, and teams are coming down on 6th of April, and we would be launching the concentrate processing and then further steps to that, and then providing this vaccine within the country. Beyond that, I think in talking in particular about our vaccine relation, China is the only country till now which has been giving vaccines to Pakistan. The other company is Sinopharm, and till today 1.5 million doses have already been donated. And the first plane which we have bought, 500,000 alhamdulillah, arrived yesterday, and the plane must be in air right now to bring in 5 million more doses. It will be landing this evening at Islamabad airport, PF airport, bringing in 5 million more doses. So I think this is again talks strength between the two countries, the way they have helped us in a very crisis period when there's a huge, I think, scarcity of vaccine all across the globe. Why so? Because the developed countries, they got the vaccine booked with all the big vendors. If you talk of Canada alone, they booked almost with a ratio of 1:4:1:5. For one person, उन्होंने 4 companies को पैसे. It was more of, I'm sorry, like a game that they put in their monies कि जी Moderna पे लगा दे, Pfizer पे लगा दें, AstraZeneca पे लगा दें, हो सकता है ये कामयाब ना हो, ये हो जाए. So they ensured, and what happened was that 90% of the vaccine was booked by the developed world, and only 10% was left for countries like Pakistan. So you can well imagine what could have gone wrong had Pakistan government not been aggressive in pursuing through China, and equally China not responding back. And what we are expecting is 10 more million in next couple of months through Sinopharm, through purchase, and CanSino, the 3 million bulk dosage will arrive at NIH inshallah by mid of April, and we are in the process of final synergizing all those things at NIH for making it happen in the Pakistan for first time. And once we move on, definitely it's a totally new world. Now this is just one aspect. Based upon this trial, what has happened is that so many other Chinese companies are pouring in Pakistan and seeking our help for guidance, for consultancy, and for clinical trials in Pakistan. I'm sure as we move on, we'll keep nurturing this, and we can bring back so much to the country in the form of what I say, research, development, academics, and top of the line, I think it's the dollar saving that we spend on vaccine. So going beyond that, we are also working with so many Chinese companies like antibodies, production of kits in Pakistan. By kits, I mean the diagnostic kits. Unfortunately, we are again not producing a single diagnostic kit in this country, and whatever do we import it most of the time. You hear a lot about the antigen testing, antibody testing, and the PCR. Whatever we are doing, we are importing it. So inshallah, time may take a couple of more years, but we are all geared up for launching such level activities whereby we start manufacturing all these things in the country. We have the capability. This country has no dearth of talent. Unfortunately, the talent goes wasted. We at NIH Alhamdulillah are providing maximum opportunity to the students coming out from Pindi, Islamabad universities, so that they actually learn practically on ground, I'm sorry, ये डिग्रियाँ बहुत जगहों में मिल रही हैं, प्रैक्टिकल वर्क का फुकदान है. जैसे आई कीप रिपीटिंग है, तालीम ज़्यादा होगी लेकिन तरबियत गायब हो गई है. So this is the difference now, what we are having. But at the end of the day, there is always light at the end of the tunnel, and we need to keep looking towards that light. And I'm sure capable people sitting over here with good brains, the leaders of the future, and under the able guidance of very capable people who are directly involved in the strategic policies, interpretation, so many international arena things, I think can do wonders. We have done wonders in the past. We have the potential to do wonders, and we will try to pick up from here, coming compatible to at least at the regional level to start with, and then keep gaining the momentum to become a developed country, inshallah. We can do all these things. We have done during this corona crisis, and I'm sure as we move on, we keep doing together. But at the end of the day, at the end of this talk, I would also like to say that once again, that we as a nation extend deepest possible gratitude and indebtedness to China for all what they have done. Would not have been possible without their support. And as we move on, there is a plan for One Belt, One Road public surveillance, because once they come down, every country, every region has its own certain inherent infections and all those things. So we did sign another MOU just before the crisis, and this crisis unfortunately evolved. We are working on synergizing our strengths as far as the CPAC road is concerned, whereby taking care of any such eventuality at the local level. It's not necessarily always a pandemic, it's not necessarily an epidemic which is at a smaller scale, but the outbreaks as well. We all know we have very common outbreaks like dengue, diarrheal diseases. So definitely once they come in, they start working, they are bound to suffer. So taking care of them comes under the domain of public health. So we are working to again strengthen our efforts as far as this is concerned. But I think together, hands in hands, we can always go together and fight it out. So thank you so much once again for inviting me, and I'm always there for anything that I can do. Thank you so much. Thank you, sir.
Ladies and gentlemen,